Madam President.
The senator from Utah.
Madam President, the bill before the Senate this week is not really about COVID relief. It's about politics. Before this, COVID relief has not been a terribly partisan issue. In fact, we've passed 5 relief bills, each with at least 90 votes. So these are overwhelmingly broad-based and bipartisan efforts. So if this one were to pass, it would be the first of those to have passed that's been highly controversial. Why? Well, because in the first place, it borrows and spends another $1.9 trillion when there are still hundreds of billions of dollars of unspent relief money from past COVID-19 relief packages. And the new spending authorizes money to go to projects in states and local governments, including many that may not even need it. The fight against the pandemic has, of course, fundamentally changed in the months since this plan was first devised and proposed. It's already outdated. Now, as we are here into the month of March, the circumstances have changed. And yet the plan remains largely the same as it was. And so it feels a little bit to me like we're fighting the last war, using the last war's battle plan, leaving us unprepared for the battle actually in front of us. This is a bill that will worsen our national debt and weaken our economy in the long run, without even doing much to help small businesses and American families in the short term. This is not without consequence. In fact, as the book by Drs. Reinhardt and Rogoff, published nearly 10 years ago, a book known as This Time It's Different, notes, once we get into this cycle, once we get accustomed to spending this much and acquiring this much of a debt to GDP ratio, we find ourselves in dire circumstances, circumstances in which it's even more difficult to raise the same revenue based on the same tax structure, or even while tweaking that tax structure. It can be very difficult to pull out of the tailspin that can be produced when we start spending in sums this large and perpetuating a debt to GDP ratio that is frankly unsustainable. This $1.9 trillion package has very, very little to do with COVID. In fact, only 1% of the spending in this bill will go toward accelerating vaccine distribution. Just 5% is focused on public health. Instead, according to the Committee for a Responsible Federal Budget, 3 times as much money will go toward partisan priorities that are, quote, not directly related to the current crisis, close quote. So what are some of the examples of this type of spending? Well, we've got $1.5 billion more set aside for Amtrak, which is itself already sitting on $1 billion of unspent bailout money. What this has to do with the virus and why the virus somehow justifies giving them an additional $1.5 billion when they're already sitting on $1 billion of still unspent bailout money is beyond my comprehension. $50 million in funding for environmental justice projects. Also difficult to connect that up to COVID. $200 million for the Institute of Museum and Library Services. $135 million for the National Endowment for the Arts. $135 million for the National Endowment for the Humanities. $86 billion in a pension bailout for private sector workers. The list goes on, but you get the idea. You get money that goes to projects as well as a significant amount to state and local governments. We'll get back to that in a moment. When there's as much as $63 billion left over in unspent funds. And this money will not necessarily even help schools to reopen. $350 billion in aid goes to state and local governments, even though total losses to date have mostly been covered by the $360 billion that Congress has already provided in aid for state and local governments over the last year. While there's some disparity among and between the states and how they've responded to the COVID pandemic and how they've fared as far as their revenues, state and local revenue has mostly recovered. And while 26 states saw general revenue declines, 21 states actually saw revenue gains. In fact, in my home state of Utah, as well as some other states, they're running surpluses. Utah's sacrifice and good governance should not go to bail out other profligate states to the tune of $350 billion. I think about hardworking moms and dads in Utah struggling to make ends meet while paying their federal and state taxes. They're told over and over and over again that they've got to be giving more. They're told that what they have spent and the time they've allotted, weeks or months out of every year just to pay their federal taxes alone, still somehow isn't enough, isn't nearly enough, because in addition to the money that they've worked so hard to earn and give to the federal government, there's so much more that has to be spent, like $1.5 billion going to Amtrak, even though it's already sitting on $1 billion of unspent bailout relief. These same moms and dads throughout Utah are not pleased when they're made to understand that in addition to bailing out Amtrak again, when Amtrak's already sitting on this $1 billion in unspent bailout relief money, that they're also going to have to bail out other states, that they're going to have to bail out state and local governments that haven't been managed well as Utah's government has. This isn't fair to them. This is a matter of fundamental fairness to them and to countless Americans, not only in Utah, but in every state. And some states still have unspent funding that they've gotten from previous COVID relief packages. California alone has $8 billion in unspent funding. And New York has up to $5 billion. In this bill, we're acting like states are facing a fiscal catastrophe that is specifically from COVID, when they're not. At the same time, we're acting like the unprecedented magnitude of federal debt is a non-issue. It is not. We've got this situation exactly backwards. Now, look, any new relief funding just needs to be targeted, and it needs to be temporary, and it needs to be directly tied to COVID relief. This package is instead about fulfilling the political wish list of one political party over another, and has very little, if anything, to do with the pandemic. It's offensive. And yes, it's inappropriate. For one political party, the political party that clings to the narrowest of margins of a majority in this body, to push its own political wish list onto an opportunity to provide COVID relief for the American people. And it would be equally inappropriate for Republicans to use it as an opportunity to push their own wish list. Look, we haven't seen this before. We haven't seen anything like this before. We didn't in the past see any of the previous COVID relief packages pushed through reconciliation. There are a number of reasons for that, one of which was it's wrong. It's not an appropriate use of reconciliation. Another was it wasn't necessary because we made it bipartisan. Not just mildly bipartisan with a few straggler votes here or there, but overwhelmingly so. This one is different. I'm not opposed to discussing what role government should play in providing actual relief from the pandemic. We can and should have that debate. I welcome it. I'd love to have it right now. In fact, that is a question that I think merits its own debate. This bill is not about that, not anything close to that. It's riddled with poor economic reasoning and rank political favoritism. It'll only worsen our debt and our economic health in the long run. It doesn't help American small businesses and families in the short run. It doesn't do anything to materially advance the cause of getting our children back to school at a time when they've suffered so greatly, not only academically, but socially and in so many other ways. That's where we ought to be focused. This bill comes nowhere close to addressing that issue, and instead, it directs itself in other directions that are not only not helpful, but in many cases, they're the opposite of that. It's sad, it's disappointing, and on that basis, I can't support this bill, but would urge my colleagues to figure out ways to make it better. We don't have to do it this way. It doesn't have to be a deeply partisan vote. We can still choose a different path. I, for one, hope we will. Thank you, Madam President.
Madam President.
The senator from Pennsylvania.
Thank you, Madam President. The circumstances that we face today in the Senate are so disturbing. This is really, really unbelievable. I mean, there's so much good news out there on the healthcare front, on the pandemic front, on the economic front. But what we're going to do in this chamber is absolutely appalling. The members of this chamber came together 5 times last year and passed overwhelmingly bipartisan bills to deal with this pandemic, to deal with the economic crisis that came from the lockdown that we experienced 5 times. About $4 trillion, completely unprecedented in scope and scale, the nature of it, never imagined before, but we did it. We did it because we needed to, and we came together. I think the biggest of the bills passed, the biggest by far, without a single no vote in this whole chamber. Completely bipartisan. So President Biden gets elected, gives a great speech, great inaugural speech about uniting the country, coming together. We don't have to be divided the way we have been. We can work together and find common ground. So 10 Republican senators go down to the White House and say, well, Mr. President, I know you'd like to do 1.9 trillion, whatever it is, but we think there's a good case for $600 billion. Now, I don't happen to agree with those 10 Republican senators as it happens. I don't think that even that is appropriate, but they did. And the reason that's significant is because there were 10 of them, which just so happens to be exactly the minimum number needed of Republican senators to join with the Democrats to pass anything they want on a bipartisan basis. So there, handed to him on a silver platter, to the president, was the opportunity to do a bipartisan bill to figure out where that common ground was. The Republicans were offering to negotiate from there. This probably could have easily ended at $1 trillion or so after just weeks before passing a $1 trillion bill. The president could have gotten so much of what he wanted, but President Biden didn't want any part of that. And you got to ask yourself, why is that? When he campaigned as the guy who's going to unify America, and he had every Republican vote he needed sitting in his office asking him to work this out, and he said, no, not interested. Effectively, that's what he said. Well, when you look at the bill, it's clear why President Biden chose this path. Because there's no justification for this bill. There's no medical justification. There's no pandemic justification. There's no economic justification. This isn't about coming together and doing something about a crisis. This is about a partisan left-wing wish list. And of course, Republicans aren't interested in that kind of political gesturing that's going to do economic damage. I'm reminded of the words of Rahm Emanuel, who famously said, "You never want a serious crisis to go to waste." Rahm Emanuel must be very proud of our Democratic colleagues and President Biden, because what they've done is they've taken a crisis that's rapidly receding, let's be honest, and they've decided this is their chance to make one last mad dash for the door with a staggering amount of money and presumably claim credit for the recovery that's already well underway. The good news is there's a lot of good news, right? We went through one of the most trying times we've been through in a very long time in this country. This pandemic was devastating, it was deadly, it was scary, and the economic crisis was very, very real. But now, we've got over 100 million doses of vaccines have gone into people's arms. When you figure that we might very well have 100 million Americans who've had the disease and recovered, we've got to have well over half of the American population has either recovered or been vaccinated, is therefore no longer at risk to this disease, not at a significant risk. And that's fantastic news. And by the way, the vaccine administration is accelerating. And so following that, we are unsurprisingly seeing this terrific collapse in the number of new cases. The daily count of new cases of the coronavirus, of COVID-19, peaked at around 250,000 new cases in a single day. We were running at that pace. By the time we got to the inauguration of President Biden, we were down to 185,000, and yesterday it was about 60,000. So less than a quarter of the number of new cases on a daily basis that we were experiencing at the peak, and it continues to drop. It's going to continue to decline, probably very rapidly, as we continue to roll out these vaccines. That's terrific. And there is a sort of parallel recovery of the economy underway. If you go back to April of 2020, when it was at its worst, the unemployment rate was almost 15%, 14.8. That's a terrible, terrible unemployment rate. As of January of this year, just a few months ago, the unemployment rate was 6.3, less than half where we were. Now, we're not back to the fantastic economy we had a year ago, just before this pandemic broke, but we're getting there. And 18 states across the country have unemployment rates below 5%. The tremendous ingenuity of the private sector to come up with vaccines that are incredibly effective, several of them, and do it in a record time. I mean, a fraction of what was the previous record time. It's amazing. And yeah, you know what? We played a role in this too. I think we did. The bipartisan cooperation in Congress to pass one bill after another on a huge scale, like I said, 5 bills. The biggest without a single dissenting. Actually, I'm not sure any of them had a dissenting vote in the Senate. And almost $1 trillion in December, leaving tens of billions of dollars that we've approved that hasn't even been spent yet. No, the intended beneficiaries have not gotten the money yet. It takes a little while to get the money out the door. So given this context, given this history, this is why it's so dispiriting to see our Democratic colleagues insisting on a bill that has almost nothing to do with COVID. That's the truth. It is not about reopening the economy. It's a partisan left-wing spending binge. That's what it is. Let's take a look at some of the individual items. We've got these so-called stimulus checks. I never heard anything more inaptly named. $414 billion. The fact is, real personal income in the country is today higher than it was just before the pandemic. Disposable real per capita income rose at its highest rate since 1984. Personal savings rate hit an all-time record high in 2020. Why? Because we more than replaced lost income through all of the bills that we passed. So what about that data suggests we need another round of universal payments to people? It's not going to stimulate the economy. Even the last check, 60% of that money went to savings accounts or paying down debt. According to a Penn Wharton study, about 75% of these checks are going to go into savings. And why in the world are we sending so many checks to tens of millions of people who've never had any lost income? So under this bill, the federal government's going to send out $5,600 to a family of four, $5,600 to a family of four that makes $150,000 a year and never had a dime of income lost. No interruption of income, no loss of income. They're going to get $5,600. And that, by the way, that's on top of the $5,800 they already got last year. With no need, no demonstrated problem here. $11,400 of money that we don't have that we're going to send to people who've never had a dime of lost income. That's a big chunk of this bill. But it may not be the worst. It may be that the worst is the $350 billion we're going to send to state and local governments to bail out the mismanaged blue states and cities. And the amazing thing is, you can't possibly make the case that they need the bailout. They don't even need it. Why do I say that? Well, if you look in 2020, the books are closed now. We know what we didn't know early in the year of 2020. We're in 2021 now. We know what happened in 2020. And what happened was states and municipalities in the aggregate brought in more revenue in 2020 than they did in 2019, which was a record year. So they've set an all-time new record for tax revenue collected. All-time new record. And that does not include the $500 billion we sent them anyway. I mean, these states are loaded with cash. I don't know what they're going to do with it. There's $60 billion in rainy day funds. We heard, oh my goodness, these states are going to have to cut essential services. All the teachers are going to be laid off. The firemen and the police officers, that's all done. How is that when they've taken in more revenue than they ever have before in their history? And then we sent them another $500 billion. So now we're going to send them yet another $350 on top of this? How does this make any sense at all? We're going to go out and borrow or print this money so that we can send it to a bunch of states, many of whom are sitting on so much cash, they're going to, I don't know, probably cut taxes. It's just unbelievable. Then there's the Obamacare expansion. What does that have to do with COVID? This is just a decade-long goal of our Democratic colleagues to continue the endless expansion of Obamacare. So $45 billion in this bill to pay insurance companies more money to cover people who already have health insurance. That's what they're doing. 63% of these new subsidies will go to people who already have health insurance through Obamacare. And by the way, it includes huge numbers of people that make over $100,000 a year. Never miss a chance to make more people dependent on government. It's got policies, big policies, that will absolutely slow the economic recovery. So let me be clear. This bill will slow down the economic recovery underway. Why do I say that? Well, the bill insists on adding $400 a week on top of whatever states are paying in unemployment benefits. Well, what does that mean? It means that more than half of everyone who's unemployed is going to get paid more not to work than they get paid working. Who could even think this up? We've had unemployment insurance for decades in this country. We have never said, let us systematically make sure that people can make more money not working than they can make if they go to work. I hear some of my colleagues talk a lot about the dignity of work. I think there's a lot of dignity in work. What is our message to people about the dignity of work when we say, you know, you're worth more to us sitting on the couch than you are at your job? That's what this is. It's a terrible idea. And how do you know for sure that nobody on the other side is even pretending that this is really about the economic recovery? Well, you know for sure because the Congressional Budget Office has told us that only a small fraction of this money is even going to be spent this year. How long do we think the pandemic is going to be with us as a pandemic? How long do we think we're going to have these lockdowns? We're going to be out of the woods pretty soon here. Well, as I said, we've got half of all Americans have been either vaccinated or recovered from this. But the school number is a good illustration, the elementary and secondary education. This bill has $128 billion. $128 billion. $6.5 billion is going to be spent in 2021. The rest gets dribbled out for years and years and years. How long do they think before schools can reopen? Oh, and by the way, this bill doesn't require the schools to reopen. You don't even have to reopen. Just throw billions and billions and billions of dollars at schools, whether or not they're actually having kids in the school. And some of these provisions are so blatantly unrelated to COVID or the economy, it's really just hard to even read them with a straight face. $86 billion to bail out multi-employer pension plans without any reform whatsoever. Now look, we all know we have a multi-employer pension problem in this country, and there's been a lot of discussion about what do you do about these grossly underfunded pension plans, and how do you fix this? And the conversation has always been what kind of reforms come with what kind of cash so that these errors of the past are corrected. There's no reforms here, none, nothing, just a big pile of cash. It's a clear message that you don't have to fix anything. You don't have to reform the flaws of these programs that got us here. And by the way, it's the same message to the insolvent public pension plans of most of the major cities and many states. Don't worry, look what Congress will do, and if the Democrats have their way, they'll just send you so much cash. You don't have to worry about the insolvency you're dealing with. What a terrible message. $270 million for the National Endowment for the Arts and Humanities. Oh, that's COVID related. Thank goodness that's there. $91 million for outreach to student loan borrowers. I don't even know what that means. $50 million for environmental justice grants. I have no idea what that means. But this one is really rich. There's about $4 billion for socially disadvantaged farmers and ranchers. I say about $4 billion because it says such sums as may be necessary. And here's what the money is for. It's going to pay off 120% of the debt of these farmers and ranchers. 120% of the borrowings. So what in the world are the requirements to have 120% of your debt paid off? Well, you actually have to have debt, okay? So you have to have borrowed money from the USDA farm loan, tens of billions of dollars out there, they lend a lot of money. And you have to be a member of one of the following groups: African American, American Indian, Alaskan Native, Asian, Hispanic, Pacific Islanders, refugees, or immigrants. As long as you're in one of those categories of racial and ethnic, mostly racial and ethnic groups, then the taxpayer is going to pay off 120%, not the whole loan, more than the whole loan, 120%. And the thing that's so disturbing about this is that the essential criteria is your skin color. The essential criteria is your race. This is unbelievable to me. By the way, there's no income test. There's no asset test for the underlying loans. There's no requirement whatsoever that COVID caused any problem, caused any lost income, or any other problem. It's not mentioned. So what's the effect of this? This means that If you have a wealthy Hispanic rancher who's got $1 million loan from the USDA, he's going to get $1.2 million. He can pay off the loan and $200,000 to do with whatever he likes. And meanwhile, if you're a poor white farmer in rural Pennsylvania and you have a $100,000 loan, you get nothing, exactly nothing. How is that even remotely fair? I don't know how that could even be constitutional. But it's certainly not in any way COVID-related. There was an amendment in the House that would have limited the payment. It would allow the program, which I object to, but it would allow this repayment of debt, but only for debt incurred during the COVID crisis. Democrats all voted that down. That failed. This is unbelievable stuff. Even the provisions that purport to be about public health are completely divorced from any reality. As I think I mentioned earlier, we're administering almost 2 million doses of vaccines every day now. That's terrific. It's actually the highest daily rate of doses administered anywhere in the world. The government has already purchased 700 million doses. Now, we've got less than 350 million Americans, and not all Americans are going to need 2 doses. So you can do the math. We have bought more vaccine doses than we need to administer. That's fine. But how many more do you need to buy when you've already bought more than enough for every single American? And that's not all we paid for. Through the previous bills that we passed, we paid for the research and development, we paid for the production, we paid for the transportation, we paid for all the accompanying supplies like syringes and the vials and the dry ice. We paid for all that. And we should have. That was the right thing to do. Insurance covers the cost of the administering of the vaccines between Medicare and Medicaid and private insurance. It's free. What is left to spend money on? I'm all ears, but I haven't heard what we need to spend money on. So what do we have in this bill? We have no justification for it in terms of public health. We certainly have no justification for it in terms of the economy. We certainly have no justification in terms of basic fairness. And frankly, it's going to do more harm than good. But you don't have to take my word for it. We could take the word of prominent liberal Democrat economists. Larry Summers. He was the Treasury Secretary under President Clinton. He was the director of the National Economic Council under President Obama. And he said, and I quote, about this bill, macroeconomic stimulus on a scale closer to World War II levels than normal recession levels will set off inflationary pressures of a kind we have not seen in a generation, end quote. Or consider the words of Steve Ratner, who's a liberal economist. President Obama named him the car czar. You may recall him administering that program. He said, and I quote, the American Rescue Plan, that's apparently what they call this. He said, the American Rescue Plan is also partly a legislative Trojan horse, an enormous aid package aimed at addressing needs that in some cases go well beyond the immediate challenges of COVID. Some of the most expensive provisions are the least well targeted to help the neediest, end quote. And that's from a liberal Democrat who I think supports the bill. But at least he's being honest in his description of it. So, Madam President, my suggestion, my plea to my Democratic colleagues, to the new president, listen to some of the things you've said. Try an approach that's actually informed by the facts on the ground, the health facts, the economic facts, the reality. Look at what the science is currently telling us about the course that this virus has been taking. And what about actually attempting to bring people together, the path of unity, after we demonstrated 5 times last year that we can work together and do something on a bipartisan basis? I urge my colleagues, don't push through this radically partisan bill that will probably, in the end, do more harm than good. And I yield the floor.
Madam President.
The senator from Wisconsin.
Madam President, let me first say I wish that this chamber was full of our colleagues to have listened to my Republican colleague, the senator from Pennsylvania's description of what this bill is and what this bill isn't. And it's not a COVID relief bill. And Senator Toomey did an excellent job. I'm hoping people are watching it on their TV screens because they really can't be reading the bill yet because it's not constructed. I don't want to repeat with the senator from Pennsylvania all the excellent points he made, but I want to come down because I think we've grown immune to these vast amounts of money. I always knew we were going to be in big trouble when we stopped talking about hundreds of billions of dollars and switched to talking about trillions of dollars. And so we talk about 1 trillion or 2 trillion. It just doesn't sound as much as a couple $100 billion or $800 billion, which was the stimulus package under the Obama administration. The fact of the matter is we have already authorized $4 trillion in COVID relief. That's 18% of last year's GDP, and roughly $1 trillion is yet to be spent. Some of that isn't even obligated. And here we are, we're going to be debating over the next couple of days, $1.9 trillion. So I just wanted to come down here to the floor and try and illustrate what a massive amount of money $1.5 trillion is, or $1.9 trillion. You have to use analogies. Again, the human mind really can't contemplate what a trillion is. I found this first analogy, my wife talked to me about it, in terms of time. So this one is simply talking about if I would give you, Madam President, $1 per second, $1 per second, how long would it take me to give you $1 million? You see the chart here, it would take 11.6 days. Again, $1 per second, how much for $1 million? 11.6 days. Next question, how long would it take you to accumulate $1 billion? Again, you do the math, you find out it would take 31.7 years. That's back when the Chinese had their protests in Tiananmen Square. So the next question is, what about $1 trillion? And this is what becomes mind-boggling. If I gave you $1 every second, and I wanted to give you $1 trillion, it would take 31,688 years to give you $1 trillion. That takes us back to beyond the last glaciation period, a period of time when Wisconsin was under a mile-thick glacier. By the way, a quick little aside for my colleague Senator from Rhode Island. Since that point in time, about 20,000 years ago, the water level in the Bay of San Francisco has increased 390 feet. Now that's global warming. That's a rise in the sea level, but that's what happened through natural causes. But that was an aside. So how long would it take to accumulate $1.9 trillion? 60,000 years. Over 60,000 years. Again, to put that in context, the human race began to develop language about 50,000 years ago. So that's the time analogy. Another way of looking at this is through distance and volume. So here's the calculation. I should have brought a dollar bill to just demonstrate its thickness, but the thickness of a dollar bill is 4.3 thousandths of an inch thick. So to illustrate how much $1 trillion is, let's start with $1 million. If you stacked $1 million bills on top of each other, they would stack up to be 358 feet high. You can see the calculation here. 358 feet, that's about a 30 to 35 foot story building. So how big would a stack of $1 billion bills be? It'd be 67.86 miles. Now, there's something called the Kármán line. I think I'm pronouncing that right. That's the point where the atmosphere ends and outer space begins. That's at 62 miles. So a stack of $1 billion would actually exceed the atmosphere and extend into outer space, 67 miles. So again, the next question is, well, how big would a stack be of $1 trillion bills? Well, it's 1,000 times that. So it'd be 67,866 miles high. That's an astonishingly large stack of dollar bills that equals $1 trillion. But again, we're not talking just $1 trillion. We're not talking about just 67 miles worth. We're talking about $1.9 trillion, which would stack up to 135,732 miles high. Now, Madam President, the distance to the moon is 238,900 miles. So that stack of $1.9 trillion worth of $1 bills would be more than halfway to the moon. That is what we are debating, spending a stack of dollar bills that extends more than halfway the distance to the moon. And this is at a point in time when we're about $28 trillion in debt. That single stack would be over 1.9 million miles. Or if you put it relative to the moon, that would be 8 stacks, 7 stacks that go directly to the moon, and one further stack that's 95% of the way there. These are astonishing sums that we're talking about, and the majority party here wants to jam this through a reconciliation process, no consultation with our side. Just blow it through here, 20 hours of debate, a vote-a-rama, pass $1.9 trillion in spending, and go home, having no consideration whatsoever of the fact that we are mortgaging our children's future. At some point in time, there will be a day of reckoning, a debt crisis, and it won't be pretty. My suggestion, at least, as we consider this, is let's actually have a debate. Let's have a discussion. Let's consider the amendments. Let's not do this in 20, 24, or 30 hours. Let's take the time to seriously consider what we are doing to our children in contemplating spending a stack of dollar bills over 135 miles high, extending more than halfway to the moon. With that, Madam President, I yield the floor.
Ms. Baldwin. Madam President.
The senator from Ohio,
Thank you, Madam President. I ask dispense with the quorum.
without objection.
Thank you, Madam President. This week, we have an opportunity to finally deliver for millions of retirees and workers in small businesses by saving America's pensions. The multi-employer pension system is on the verge of collapse, threatening the livelihoods of more than a million Americans and thousands of small businesses from New Hampshire to Ohio across the country. This affects more than 100,000 workers and retirees in my state alone and millions more around the country. These pension plans were in danger before. Now the economic emergency we're in has accelerated the crisis even further. Multi-employer pension plans receive contributions based on the hours worked. As workers have been laid off during the pandemic, their employers no longer contribute to the pension plans, while current retirees continue receiving their earned benefits, making the plan even more likely to fail. And if that happens, Madam President, it won't just be retirees feeling the pain. Current workers will be stuck paying into pension funds for benefits they'll never receive. Small businesses will be left drowning in pension liability they can't afford to pay. Small businesses that have been in the family for generations could face bankruptcy, and workers will lose jobs at businesses which have been forced to close up shop. The effect will ripple across the entire economy at a time when we can least afford it. The Chamber of Commerce has said the multi-employer pension system is an integral part of our economy. It's not only union businesses that participate in these plans that will close their doors. This will devastate small communities across the industrial heartland. Small businesses in these communities are already hurting because of the virus. That's why we have to get this done. After a lifetime of hard work in service to our country, these workers and retirees have already waited far too long for Congress to do the job we should have done. We've been trying to solve this for years. Unions, the Chamber of Commerce, small businesses pretty much agree we need to get this done. The House has done its part. They've passed a solution multiple times. Every time it stopped because of Mitch McConnell in the United States Senate. He has deliberately blocked it. We have continued to try. The House does it year after year. People like the presiding officer and others have fought for this, and the Finance Committee have fought for this on the Senate floor, and we simply haven't been able to move it. Now, Senator McConnell's out of the way, and we can finally keep the promise to these workers and their families. They spent years working on assembly lines, bagging groceries, driving trucks, working to keep our economy going, and the money came out of every single one of their paychecks to earn these pensions. People in this town don't always understand the collective bargaining process. People give up dollars at the bargaining table today for the promise of a secure retirement with health care and a pension. That's what collective bargaining is. Union workers sit down with each other and their employer to talk about giving up wages, and are willing to give up wages today to have a more secure future. What's more American than that? And for years now, they've lived in fear of drastic cuts. One retiree from Michigan told us he'd lose 2/3 of his income, and that at 71 years old, there's no jobs out there that he could recover what we'd lose, that we could get to recover what we'd lose. He said, pass the Butch-Lewis Act so we can take this weight off of us and retire with the dignity that we earned for 30, 40, 50 years of hardworking labor. It's always the same story. When Wall Street's in trouble, there's a bailout. When corporation needs something, the stock market's in trouble, the Washington elite drop everything to help. But these workers, they're not asking for a bailout. They're not asking for a handout. They're just asking for what they earn. These workers have been in the fight for years. Their activism has gotten us this far. They've traveled all day and all night on buses. They've rallied outside in the bitter cold, in the hot DC summer, all trying to get people in this town to listen. Let's finally deliver for them. Let's give them peace of mind. Let's keep this promise. It comes back to the dignity of work. When work has dignity, we honor the retirement security people earn. When work has dignity, we honor their retirement security that they gave up at the bargaining table in collective bargaining. I urge my Republican colleagues in this body, colleagues with health care and retirement plans paid for by taxpayers, including these taxpayers that have been paying into their own pension fund for years. I urge my Republican colleagues to think about these retired workers and think about the small business owners, companies like Smuckers, There's a baker in Navarre, Ohio. Think of the candy company Spangler and Bryan, Ohio. Companies like that. Think about these retired workers. Think about these small business owners. Think about the stress they're facing. I've listened to my colleagues' speeches for years, extolling the values of hard work and the virtue of small businesses. This is your chance to live up to your own words, to show Americans if you work hard all your life, your government will in fact be there for you. Join us, let's pass a solution that really indeed does honor the dignity of work. Madam President, I note the absence of quorum.
The clerk will call the roll.
Ms. Baldwin.
Madam President,
The senator from Alaska,
Madam President, I ask that the quorum call be eviscerated.
without objection.
Madam President, it's that time of the week that, our pages, when we had them, used to always look forward to. It's the time of week that I come down on the floor and talk about someone in Alaska who's making a huge impact on my state. A lot of times for the country, these two Alaskans I'm going to talk about actually have gotten national news for the great work that they're doing. Somebody we call our Alaskans of the Week, and it's usually about a group of individuals, one, two, maybe a group of people who are helping make Alaska what in my view is the greatest state in the country. Resilient, tough, generous, kind, unique. And Madam President, like so many states, this pandemic has really hit Alaska hard. Tourism, for sure. The oil and gas sector, last year really hit hard with low prices. Unfortunately, this year with the Biden administration's attacks on this sector of the U.S. and Alaska economy, it's tough. Commercial fishing, tough. It's been a tough year economically, but in an area of good news during the pandemic, one that I'm very proud of for all my constituents, involving how we in Alaska have responded on the health side. Vaccines, testing, death rates. We have consistently been the top state rated in all of these categories throughout the pandemic, which is kind of amazing given that we are a very, very big state with a very small population. I know that so many Americans watching right now, they want to get back out, visit Alaska. Our governor, Mike Dunleavy, recently tweeted, with the best vaccination efforts in the country and some of the lowest COVID numbers in the country, Alaska is open for business, safe for travelers. So come on, America, get back up to Alaska. Love to have you. So this is all very true. Our vaccination efforts are viewed as the best in the United States of America. And the great lengths that so many in Alaska have gone through to make it so have captured the country's imagination. These efforts, just in the last couple weeks, have been featured all across the country. USA Today, Good Morning America, The Washington Post, The New York Times, a great piece by Bloomberg News, and so many others. So big thanks to the press corps, National Press Corps, for featuring my state's efforts and, importantly, the heroic work being done to distribute life-saving vaccines to a state that is more than 2.5 times the size of Texas. Sorry there, Senator Cornyn, Senator Cruz, it's true. And most of the geography of Alaska is dotted with small villages without roads in freezing cold temperatures. I was in Fairbanks last weekend, just a couple weeks ago in Fairbanks, almost hit 40 below. That is cold. All across Alaska, our healthcare workers are jumping on boats, single prop airplanes, snow machines, and yes, in a couple cases, dog sleds to bring the vaccine and hope to their fellow Alaskans. And it shows. As of a few days ago, close to 160,000 Alaskans received at least their first vaccine dose. That is about 21% of our state's population. Now, Madam President, in Southwest Alaska, what we call the Yukon-Kuskokwim Delta, or the YK Delta, those are two giant rivers that come together, these efforts have been particularly impressive. That's largely thanks to the amazing people at the YK Health Corporation, or YKHC, which is the YK Delta's tribal health provider. The whole organization, consisting just about 90 healthcare professionals, serves around 28,000 people in the YK region, which is about the size of Oregon. So huge area, not a lot of people. And prior to the vaccine, the YK Delta had been stricken by COVID-19 with one of the highest infection rates in the country, in a very far-flung place in terms of the disbursement of the population. But it's the efforts of two women there in the YK Delta, Doctors Ellen Hodges and Elizabeth Bates, who are our Alaskans of the Week, who have been in charge getting the vaccine to roughly 50 remote villages in southwestern Alaska, spread out over a territory, as I said, about the size of Oregon. The village populations in the YK Delta range from about 1,200 people to as small as 10 in terms of population. So let's start with Dr. Hodges. She is the chief of staff at YKHC. She grew up in rural Minnesota. After graduating from the University of Minnesota Medical School, Dr. Hodges came to Anchorage as a resident in 2002, eventually making her way to Bethel, which is the hub village. It's a big community, the biggest in the YK Delta. She absolutely fell in love with the area. She said, it has everything, very friendly people, authentic, it's beautiful. Soon enough, her patients turned into her family. Also soon enough, she was, according to Tricia Franklin, Alaska's Director of the State Office of Rural Health Division. She was, Dr. Hodges, the go-to person for how things are working in rural communities and how to get things done. She worked in the emergency room, tending cuts, bruises, broken bones. She delivered babies. She worked tirelessly to contain a number of serious tuberculosis outbreaks in the region. And then, Madam President, the virus hit. And as I mentioned, it hit the YK Delta region very hard with some of the highest COVID rates in America. And there are reasons for that. The multi-generational housing, very crowded housing in this region, communal lifestyle. And also, here's a big one, Madam President, and it should be a shock for every American listening. About 50% of the households in this region of America lack running water. Let me say that again. Some of the most patriotic communities in the country, because Alaska Natives serve at higher rates in the military than any other ethnic group in the country, live in communities that don't have running water or flush toilets. American citizens. It's wrong. It's wrong. And we, the U.S. Senate, Congress, need to continue to work on this issue. How do you wash your hands 5 times a day, but as the CDC wants you to do during the pandemic when you don't have running water or flush toilets? We need to keep working on this. It's a disgrace, to be honest. So what happened when COVID hit in this region, because of a lack of sanitation and many other problems, precious lives were being lost. Elders who are vital to pass on the traditional wisdom of the Native Alaskan culture and heritage were being lost. And because of a lack of functioning sanitation, even young people, which this virus doesn't really impact, were starting to have respiratory illnesses and getting sick, and some were even dying. It's horrible. It was terrifying, particularly for an area that is still dealing with the multi-generational trauma of previous pandemics, particularly the Spanish flu of 1918, which in several Alaska Native communities wiped out entire communities. 60, 70% mortality rates from that flu. So we needed to get to work fast, particularly in this region. Enter another intrepid doctor and our other Alaskan of the week, Dr. Elizabeth Bates. Dr. Bates arrived in Bethel in December 2018, just a little over 2 years ago, and she found a community that she loved. She had experience working in women's health, in infection control, in emergency care, and disaster relief. She has great experience across the country, really across the world. As a doctor, she worked with patients during 9/11, Hurricane Katrina, and had spent time even in refugee camps in Rwanda. In Bethel, she was in charge of setting up testing centers for the region. Working hand in glove with Dr. Hodges, she started one of the first drive-through and airport testing sites in rural Alaska, much of it outside in the cold weather under tarps. But we all know, Madam President, that testing alone, particularly, as I said, when people are living so close together and don't live in places where you can wash your hands frequently, testing alone wasn't nearly enough. They tried everything: public service announcements, reaching out to villagers, helping them use bleach to sanitize. It was a 24/7 effort, but as I said, it wasn't enough. The virus was spreading rapidly. They were losing. People were dying. And then, on December 18th, a few days before winter solstice, the darkest day of the year, hope came to Bethel, Alaska, because the first vaccines arrived. Thanks to the great work of so many scientists, government workers, private sector workers, Operation Warp Speed, the vaccine arrived. December 18th, the YK Delta. These two intrepid doctors I've been talking about cried. They had seen a lot of death and struggles in the region, and like a Christmas miracle, this vaccine arrived. They hugged each other, and then they got to work. As I said, there are roughly 50 remote villages in the YK Delta spread out over a territory about the size of many states in our country. As a matter of fact, bigger than most states in our country. So they traveled on small planes, trucks on ice roads, snow machines, dog sleds. Their operation, Project Togo, named in reference to one of the famous sled dogs that helped carry the diphtheria serum to Nome, which of course is the original inspiration for the Iditarod sled dog race. Sometimes it was so cold that they had to keep the fringes filled with COVID serum under their clothes, lest the serum froze. The operation that they initiated and organized has hit every single village, all 50 in the YK Delta, bringing the vaccine to pretty much anyone who wants it. In some villages, they've been able to vaccinate as much as half the population. As a result, the numbers of COVID infections and deaths are plummeting in this region, and hope is spreading. This great team, Dr. Hodges and Bates, as well as all in the community and all working at YKHC, have made a huge difference. And this team has created a special bond that nobody will forget. Dr. Bates, a relative newcomer in Alaska, says that the experience has made her fall in love with the YK Delta region even more. She bought a home. She intends on staying. She describes the beauty of the region. Something that she appreciates even more now is, quote, "Our sky is huge. We have a front row seat to the entire universe." These two doctors also have a front row seat in providing a front row seat to hope during this pandemic. So I want to thank both of them again, Dr. Hodges and Dr. Bates, and to all those across Alaska who are helping distribute the vaccine. As I mentioned, right now, Alaska is the #1 state in the country per capita in terms of vaccine distribution, and the #1 state per capita in terms of testing, and one of the lowest death rates. This is really amazing, really, when you see how big and widespread and harsh the weather conditions can be in the great state of Alaska. Our fellow Alaskans are tough, resilient, innovative, and Dr. Hodges and Dr. Bates are a huge and essential part of this effort. And that's why I want to congratulate them and thank them again for being our Alaskans of the week. I yield the floor.
Madam President,
The Assistant Majority
I
Leader?
ask consent the quorum call be suspended.
We are not in a quorum call at
Thank you
this
very
moment.
much. I ask unanimous consent the Committee on Health, Education, Labor, and Pensions be discharged from further consideration of S-164 and the Senate proceed to its immediate consideration.
The clerk will report.
S-164, a bill to educate healthcare providers and the public on biosimilar biological products and for other purposes.
Without objection, the committee is discharged and the Senate will proceed to the measure.
I ask unanimous consent the bill be considered read a third time and passed. The motions to reconsider be considered made and laid upon the table.
Without objection.
Madam President, I ask unanimous consent that the Senate proceed to the immediate consideration of S-578, which was introduced earlier today.
The clerk will report.
S-578, a bill to improve the health and safety of Americans living with food allergies and so forth, and for other purposes.
Without objection, the Senate will proceed to the measure.
I further ask the bill be read a third time and passed. The motion to reconsider be considered made and laid upon the table with no intervening action or debate.
Without objection.
Madam President, I ask unanimous consent the Senate proceed to the immediate consideration of S-579, which was introduced earlier today.
The clerk will report.
S-579, a bill to make a technical correction to the ALS Disability Insurance Access Act of 2019.
Without objection, the Senate will proceed to the measure.
I further ask the bill be read a third time and passed. The motion to reconsider be considered made and laid upon the table with no intervening action or debate.
Without objection.
Madam President, I ask unanimous consent the Senate now proceed to the en bloc consideration of the following Senate resolutions which were submitted earlier today. S-Res 90, School Counseling Week. S-Res 91, CTE Month. S-Res 92, Speech and Debate Education Day. S-Res 93, University of Alabama Crimson Tide.
Without objection, the Senate will proceed to the resolutions en bloc.
I ask unanimous consent that the resolutions be agreed to, the preambles be agreed to, the motions to reconsider be considered made and laid upon the table, all en bloc.
Without objection.
Madam President, I ask unanimous consent the Senate proceed to the consideration of S-Res 94 submitted earlier today.
The clerk will report.
Senate Resolution 94, designating the week beginning February 28th, 2021 as National Tribal Colleges and Universities Week.
Without objection, the Senate will proceed to the measure.
I know of no further debate on the resolution.
If there's no further debate, the question is on the resolution. All in favor, say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes do have it. The resolution is agreed to.
I ask unanimous consent that the preamble be agreed to, that the motions to reconsider be considered made and laid upon the table with no intervening action or debate.
Without objection.
Madam President, I ask unanimous consent that when the Senate completes its business today, it adjourn until 12 noon Thursday, March the 4th, that following the prayer and pledge, the morning hour be deemed expired, the journal of proceedings be approved to date, and the time for the two leaders be reserved for their use later in the day, the morning business be closed.
Without objection.
If there's no further business to come before the Senate, I ask that it stand adjourned under the previous order.
The Senate stands adjourned till 12 noon tomorrow.